What if your anxiety is not a character flaw, but your nervous system trying very hard to protect you? In the last video, we saw how you can get stuck in survival mode, mostly red zone, mostly blue zone, or swinging between both. Today is all about one thing: how to come down from the red zone, from always on edge to safe enough right now. I'm going to give you 3 levers you can pull. Think of them as 3 ways to tell your body you can stand down for a bit. Let's dive in. Quick recap in 1 minute. Red zone is hyperarousal. Your gas pedal is pressed down. Your sympathetic nervous system is active. You might feel anxious, restless, jumpy, racing thoughts, racing heart, tight chest, tight jaw, knots in your stomach, like you must do something, fix something, control something. This is not you being dramatic. It is your survival system preparing you to fight or run. The goal is not to get rid of this system. The goal is to help it do its job, without hijacking your whole life. So, how do you come down from red? Lever number 1. Change your breathing on purpose for a few minutes. Not because breath work is trendy, because your breath is one of the fastest ways to talk directly to your nervous system. When you are in fight or flight, your breathing is usually fast and shallow. Short inhales. Short exhales. Your brain reads that as danger. We want to send the opposite message. Here is a simple pattern you can try. Inhale gently through your nose for a count of 4. 1, 2, 3, 4. Pause for 1. Then exhale slowly through your mouth for a count of 6. 1, 2, 3, 4, 5, 6. Repeat for a few minutes. Longer exhale than inhale. You are not forcing yourself to be calm. You are changing the signal your body is sending upstairs. Many studies show that slow, controlled breathing with a slightly longer exhale increases the activity of the rest and digest branch of your nervous system and can reduce feelings of anxiety in the short term. Web. 2. Web. 4. Web 194. Web 188. You might notice a tiny shift after 30 to 60 seconds. Your shoulders drop a little, your jaw unlocks. Thoughts are still there, but they feel a bit further away. That is enough. You are not looking for magic. You are looking for 1 notch down on the dial. You can do this sitting, standing, or lying down. You can do it in bed, on the bus, in a bathroom stall. Pick 1 everyday cue. For example, every time you sit at your desk or before you open a stressful email. Pair that moment with 1 minute of this breathing. You are training your system, not just reacting to it. Lever number 2. Ground in the present with your body and your senses. When anxiety pulls you into what if, your body goes with it. Grounding techniques help you come back to right now. They do 2 things at once. They give your mind something concrete to focus on, and they send your body small signals of safety. Web, X, Web, 121, Web, 125. Let me walk you through a simple one. It is called the 5-4-3-2-1 method. You can do it almost anywhere. Step 1. Look around and silently name 5 things you can see. The more specific, the better. Blue mug, crack in the wall, light on the ceiling. Step 2. Notice 4 things you can feel through touch. Your feet on the floor, your back against the chair, the fabric of your clothes, the temperature of the air on your skin. Step 3. Listen for 3 sounds. The hum of a fridge, traffic outside, voices in the hallway. Step 4. Notice 2 things you can smell. Coffee, soap, air, even no strong smell. Step 5. Notice 1 thing you can taste. Maybe water, maybe the aftertaste in your mouth. This whole thing can take 1 to 3 minutes. You might feel silly at first. That is okay. You are not trying to be elegant. You are trying to give your brain evidence that in this exact moment, you are physically safe enough. Research suggests that grounding practices like this progressive muscle relaxation or short body scans can reduce state anxiety and help the body. Shift out of acute fight-or-flight activation. Again, we are only looking for one step down. Less spinning, slightly more here. Lever number 3. Relax tension on purpose, instead of waiting for it to disappear. When you live in the red zone, your muscles often stay partially contracted all day, shoulders up, jaw tight, stomach clenched. Your brain reads that tension as more evidence of danger. One simple way to interrupt this loop is progressive muscle relaxation. Here is a very short version you can use. You can do it sitting or lying down. First, pick one area, like your hands. Make fists gently as you inhale. Notice the tension. Then, as you exhale slowly, let your fingers open and the muscles soften. Do that 2 or 3 times. Then move to another area, your shoulders. Lift them slightly as you breathe in, then drop them as you breathe out. Notice the difference between on and off. Studies in different groups, from students before exams to patients in hospital, have found that progressive muscle relaxation can lower anxiety and sometimes even improve sleep, especially when practiced regularly. You do not need to do a full 20-minute routine. Even 2 or 3 areas, hands, shoulders, jaw, can break the cycle of tension, feeding more alarm. So we have 3 levers: breath, grounding, release. Let's put them together in one tiny protocol you can actually remember. I call it 3 minutes to step down. Minute 1, breathe. Use the 4-6 pattern. In through the nose for 4. Pause, out through the mouth for 6. Gentle, not forced. Minute 2, ground. Do a quick 5, 4, 3, 2, 1, or at least notice 5 things you can see and 4 things you can feel. Bring your attention back to your body and the room. Minute 3, release. Pick 2 muscle groups, hands and shoulders. Tense them gently as you breathe in. Soften as you breathe out. That is it. 3 minutes. Is this going to cure lifelong anxiety? No, but used consistently. These practices can train your nervous system to come down from red a little faster, a little more often. And that matters. Because every time you come down, even 1 notch, you are spending more time in your window of tolerance. More time where you can feel and think. More time where you can respond instead of just react. 2 important notes before we close. First, these tools are not a replacement for therapy or medical care. They are supports. If your anxiety is severe, if you have panic attacks, or if you suspect trauma, please consider working with a qualified professional. Second, sometimes red zone feelings are trying to tell you something real. Maybe you do need a boundary, a conversation, a change. Calming your system is not about ignoring real problems. It is about getting you back into a state where you can face them with more clarity. In the next video, we are going to look at the other side. What to do when you are mostly in the blue zone, when you feel numb, flat, or shut down. And just relax is the last thing you need. If this video helped you feel a little less broken and a little more understandable, subscribe for more evidence-based content on anxiety, stress, and your nervous system. And tell me in the comments, when you are in the red zone, which lever do you want to try first? A, breath. B, grounding. C, release. D, something else. See you in the next one.